Hello guys, welcome to Homeo Health Care. So today we are going to discuss on the topic hemorrhoids. Before going into the detail, to understand it well, let's have a basic overview on the anatomy of the alimentary canal or a GI tract. So first and most there will be the esophagus, then J-shaped stomach, small intestine, which is the first part of duodenum, second jejunum, then ileum, then large intestine, ascending colon, transverse colon, descending colon, rectum. So, where will be the problem for the hemorrhoids? It will be in the anal canal, where the veins are dilated within that anal canal. This is condition is termed as hemorrhoids, and it is further has divided into two categories like internal hemorrhoids and external hemorrhoids. So first we will see what is the internal hemorrhoids. So when the hemorrhoids lies within the anal canal and inside the anal orifice, it is termed as the internal hemorrhoids, and this is covered by the mucous membrane, and it commences at the anorectal ring. If we see the appearance or color of hemorrhoids, then it is either of a bright red color or the purple color. Then, what about external hemorrhoids? What is it? This hemorrhoids lies outside the anal orifice, and it has a covering of the skin. ती जे आहे ते स्किननी कव्हर केल्या गेली राहते ते असते एक्सटर्नल हेमोरॉइड्स, and it is associated with the conditions like the dilatation of veins at the anal verge or the perianal hematoma. Such conditions may be associated with the external hemorrhoids. Then there is also some condition like secondary hemorrhoids. So now, what is this secondary hemorrhoids? Let's understand this. If any other condition, disease condition is present in the patient, along with that is having some this hemorrhoid condition, then it is termed as the secondary hemorrhoids. Like if there is a carcinoma of rectum and that patient is having the hemorrhoids, it is secondary hemorrhoids. If a woman or a lady who is pregnant, having pregnancy, at that time she is suffering from the hemorrhoids condition, it also falls under the secondary hemorrhoids. Then there is also a condition like difficulty in maturation, and this can be seen in the conditions like stricture urethra or the enlargement of prostate. In these both conditions, there will be the difficulty in passing urine, difficulty in the maturation, and along with such condition, if the hemorrhoids are present, then it is also termed as secondary hemorrhoids. And there will be a chronic constipation. If you see the physiological function, there will be a defecation, passing of stool, and if there is some abnormality, the physiological condition will get altered at that time. So what will be there? Difficulty in passing stools. And if this condition remains persistent, then it will term as the chronic constipation. Then, what about the pathology? What pathological changes will be there? There will be the pedicle, and this pedicle will lie just above the anorectal ring, and it is also covered by the mucous membrane. And distal to that, what will be there? The body of the internal hemorrhoids. This pathology will be there. Then, what about the clinical features? What clinical features you are going to see in the patients of the hemorrhoids? So, the patient will give the complaint of the bleeding while defecation or passing the stool. Like whenever the patient defecates or passes the stools, the blood will come out, and this condition remains persistent for a months or years. Then the color of blood will be of bright red. Then what other features you will see along with this bleeding? There will be a mucus discharges. The mucus discharges will also present in the stools. After that, the pruritus ani, that means the itching in the anal region. This condition may also present in that patient. After that, the anemic condition also can be seen in the such patients who is suffering from the bleeding hemorrhoids. If the bleeding remains persistent and profuse, then the anemic condition will also be there in that patient. After that, prolapse, and it has the various degrees of the prolapse, which are in the four, like first degree, second degree, third degree, and fourth degree. So first we will see what is the first degree prolapse. In first degree prolapse, the hemorrhoids will always remain within the anal orifice, lies in the anal canal. It won't come out. If it is a second degree of hemorrhoids, then what will happen? While defecating or while passing the stools, the hemorrhoids will come outside the anal orifice. But as soon as the defecation process gets completed, it revert back into the anal canal. And if the hemorrhoids are coming out of the anal orifice while defecation, and it is remaining there only after the process, and the patient has mechanically to make it back, to reverse it, then it falls under the third degree prolapse. Then what? Fourth degree prolapse, there will be the permanent prolapse of this hemorrhoid, which will persistently remain outside the anal orifice. Then what complications the patient will suffer if this condition is not treated? There will be more and more bleeding. That is, the hemorrhagic condition will be there. Thrombosis can be there. Fibrosis, gangrene, etc. And many more complications can come to the patient if they are not treated. Then what can be the miasm behind these hemorrhoids? If we see the pathology of the hemorrhoids, what is there? It is an outgrowth, that is swelling. This outgrowth falls under the psychosis miasm. So If we correlate this pathology, it comes under the psychosis miasm. But if there is more of bleeding, then syphilitic traits may also present. Syphilitics can be also present, but more of psychosis will be there as there is a out. Then what about its treatment part? In homeopathy, after taking a case, working out that case, analyzing that case, what remedy comes up, that after administering that it suits to the patient, and after a course of treatment it will be like a patient will not have such complaints in what he has came to the us. जब कोई हेमोरॉइड्स का पेशेंट आता है, उसकी अच्छे से केस ली जाती है। केस लेने के बाद उसके ऊपर वर्कआउट करके उसे जो दवा ऊपर आती है वो उसे देने के बाद जो कोर्स ऑफ ट्रीटमेंट में जो तकलीफ में पेशेंट आता है वो तकलीफ उसे नहीं रहती है। आफ्टर एखादा व्यक्ती एखादा पेशंट जेव्हा येतो ज्याला हेमोरॉइड्स आहे त्याची जेव्हा केस घेतल्या जाते, केसवर चांगल्याने वर्कआउट केल्या जाते, त्यानंतर जी कोणती औषध वर निघून येतं, जे ॲडमिनिस्टर केल्याने त्याला आराम पडतो, त्याला तितकासा त्रास राहत नाही ज्या त्रासामध्ये तो आला होता. As we say, we treat the man in disease and not the only disease in the man. So, if you like this video, then subscribe to my channel. Thank you.